Now we're going to turn to healthcare, and among the biggest advances this year are breakthroughs in the fight against skin cancer. Bloomberg healthcare reporter Shannon Pettypiece joins us now from the American Society of Clinical Oncology meeting in Chicago. Hey Shannon, good to see you.
Hey Lisa, thank you. I'm here with Lynn Schuchter. She is one of the top melanoma researchers out there. She's a doctor at the University of Pennsylvania, and she's been very closely involved in all of this skin cancer data coming out of this meeting we're at. And Lynn, tell me, how has being a melanoma doctor changed over the past 5 years, and where do you see it going?
Well, you know, melanoma has been a very, very difficult cancer to treat. It's a type of skin cancer, and we haven't had effective therapies. So it's been tough taking care of patients that didn't have a lot of opportunities for new therapies. So now this is an incredibly exciting time to be a melanoma investigator, to be a melanoma clinician, because we have wonderful new opportunities to share with our patients. We're celebrating with our patients, and it's a really exciting, wonderful time.
Well, with one new drug on the market, potentially two promising ones behind it. Now, right now, I know once melanoma is spread, patients only have a few months to live. What do you think the survival could look like 5-10 years from now? What could it be like to be a melanoma patient in the future?
Right, so now we don't have a therapy that can cure patients whose melanoma has spread. Of course, if melanoma is detected early, it's 100% curable. So early detection is still key. But now we're understanding the drivers of melanoma, the genes that are abnormal, and that opens up new possibilities for treatment. So I think in the future, we are going to find very effective therapies that can actually cure patients, that essentially tackle the Achilles heel of a cancer cell. And we think this is going to be a combination of multiple therapies that are going to need to be delivered to a patient. We think that we're going to have to really characterize the melanoma. What are the specific genetic abnormalities in a patient's melanoma, and tailor that therapy or personalize that therapy to that patient's melanoma.
Well, you mentioned combinations, because I'm wondering if there's, of these new drugs coming out, a winner or a loser, or if there's really room in a doctor's arsenal for all of them.
No, that's a great point. We do think that this is going to be sequential. So if a patient's tumor is tested and has a mutated or activated BRAF gene, and they have symptoms from melanoma, likely most physicians are going to choose vemurafenib once that medicine is approved. But ipilimumab, also known as Yervoy, will also have a place, because these therapies, while very effective, also can stop working. And so we need to think about what's going to be the next step and the next step. And really, it's the combinations that are going to look helpful. We think combining ipilimumab with vemurafenib is really going to be a potentially interesting study and opportunity for patients.
In just a few seconds here, is this an area that we're going to see growing melanoma, more and more cases coming? Is that something?
Yeah, so we're seeing an epidemic of melanoma and a rising incidence. And we're particularly concerned about all the melanoma in young people and young women. They're going to tanning salons, there's greater exposure to the sun. So it's very clear that sunlight is a carcinogen, and people need to be protected and avoid excessive sun exposure. Well, this is preventable.
A good reminder this time of year as the sun comes out behind me. Thank you very much.